So, good morning and good afternoon, depending on where you're joining us from today. I am Matthew Hart from Longwoods Publishing. Longwoods is a publisher of healthcare research, reports, and news. Our goal is to promote an exchange between researchers, health professionals, policymakers, and other stakeholders that yield innovative and effective healthcare ideas, policies, and practices. Our speakers and our moderator are joining us today from across the country, from Montreal, Toronto, Hamilton, Vancouver. I am here today from Pickering, Ontario, which is the home of the Mississaugas of Scugog Island First Nation. They moved into southern Ontario from their former homeland north of Lake Huron around 1700. The Mississaugas are a branch of the Greater Ojibwa Nation. This land was used and is used by the Mississauga people for hunting, fishing, harvesting plant materials for food and medicines. Wild rice was very important food staple for the Mississaugas, but due to highway construction and other projects, many of the lakes were flooded, which has drastically reduced the harvest. Our host today will be joining us from Montreal, which is the traditional territory of the St. Lawrence Iroquois, the Mohawk, the Huron-Wendat, and the Haudenosaunee. Thank you very much for the use of your land today. Our discussion is in partnership with Novartis Canada and focused on the second Health Equity Initiative. Over the next hour, our panelists will talk about healthcare and equity gaps Canadians face and some of the more important work and highlight some of the more important work that the changemakers across the country are undertaking to support and the underserved communities. Before we begin, I'll just go through a few little housekeeping notes. Your microphones have been muted for the ease of the discussion. While there will not be Q&A in order to maximize time for the conversation today, if you do have questions, please feel free to get in touch with Novartis. I'll give you their email now, but then we'll also include the email in the follow-up email that when the video is ready. But the email is camlph.communications@novartis.com. Remember to follow everybody on social media. You can tag Longwoods, tag Novartis, the Olive Branch of Hope, Mums Against Racism Canada, and Hamilton Health Sciences. I would now like to hand it over to our moderator, Rosa Conte, from Novartis Canada, the Country Communications and Patient Advocacy Head. Rosa, all yours.
Thank you very much, Matt. Hello, everyone. Thank you for joining us today. We will discuss an important topic, health equity, and we will celebrate the winners of our second edition. I would like to start grounding us on the topic of today, because despite having a publicly funded healthcare system, many people across Canada face really high challenges accessing timely and appropriate care through regular healthcare providers. And if we look at recent reports from the Commonwealth Funds, we can see that Canada ranks third to last in access to, let's say, equity in healthcare and experience among 9 peer countries. Women, Indigenous people, rural and remote communities, low-income families, too, as LGBTQIA+ individuals and newcomers to Canada are the most impacted by these systemic barriers that affect well-being and also in the long term, for sure, the quality of life. That's why we also wanted to play a part in this as Novartis Canada, because we truly believe that people deserve the same access to care. Canadians deserve the same access to quality care. And we also believe that health equity is essential to build a healthier, more resilient society for the future. We launched this initiative in 2024, and it was really testament of our commitment to helping closing the gap in care, supporting individuals and organizations where they are in the communities, because they know best how to understand the local challenges, and they are already working and delivering impact for those communities. So that's why with this project, we address these root causes of health equity, and we aim to create a future where all Canadians can face fair access to care. This year, we announced the winners of this edition last week. We had the pleasure of having with us the Health Federal Minister of Health, Marjorie Michel, and she was celebrating the winners with us. So it was really an incredible moment. And today we are also delighted to have the winners with us to discuss challenges, opportunities, and ideas for health equity. So it is my pleasure and honor to introduce our panelists today. First, Rochelle Rain Sr. She is the lead and strategic advisor, health equity, the diversity and inclusion at the Hamilton Health Sciences, a network of 11 healthcare sites and centers in Ontario that facilitates 2.3 million patient visits annually. That's really incredible. Many of these patients come from equity denied groups, highlighting the organization's commitment to address systemic health disparity. And they have a focus on prescribing. So it's really transformational healthcare that they are delivering. Thank you for being with us, Rochelle. The second panelist is Charles Wong Richardson, Board Director of Moms Against Racism Canada, a grassroots nonprofit organization dedicated to dismantling systemic barriers in mental health care for neurodivergent individuals with Black, Indigenous, and people of color communities. Recognizing the intersectionality of race, neurodivergence, and the cultural stigma, the organization develops culturally responsive, neuro-affirming mental health tools to create inclusive and accessible care solutions. Thanks for being with us. And last but certainly not least, Patricia Russell. She's lead ambassador at the Olive Branch of Hope, a nonprofit organization dedicated to supporting Black women on their journey through breast cancer. Its mission is to provide accessible breast cancer education, free screenings, and culturally safe spaces for Black women, ensuring equity in a healthcare system that has historically underserved this population. And now I'll say, without further ado, we can start our conversation. The first segment is really about building health equity. And I would like to approach this topic starting from the challenges that our panelists may see in their communities. So, Rochelle, the first question is for you. What are some of the biggest challenges that currently exist within the Hamilton area, and which areas of care are most critically to be addressed first?
Yeah, thanks so much for the question, Rosa. You know, Hamilton is an incredibly diverse city with many newcomers. We're also situated very, very close to one of the largest Indigenous reserves within Canada. And so, you know, Hamilton kind of carries this resilient and diverse essence to it, which I think can be a strength to the city, but it also has a number of challenges in which we're facing. And a number of those challenges were highlighted in a local newspaper about 15 years ago, where they did a study called Hamilton's Code Red. And essentially, it looked at exposing some of the health gaps across the city. And what it found was that lower income neighborhoods were living up to 21 years less than those from wealthier neighborhoods. And so obviously, you know, there are a number of competing pieces that contribute to that. And the series itself was revisited about a decade later, and shockingly, the results were pretty much the same. And so I think that highlights a number of challenges that Hamilton is seeing within the community, with many of the same inequalities still entrenched in some of those code red neighborhoods. And it's a long-standing issue, showing how poverty, social conditions, and how those pieces directly shape life expectancy. It impacts our hospital use, and it overall impacts the health and well-being of those within the community. So right now, I would say from my vantage point, there are three key areas or key challenges that stand out more clearly. Mental health and addictions is certainly a challenge within the city of Hamilton. We're seeing a growing demand for mental health supports, and namely supports that are required from those from vulnerable communities, and also looking at those from unhoused persons, people living in poverty, as well as those that are experiencing racism and discrimination. I think that COVID has done a number on many communities, but I think Hamilton in particular has certainly been hit hard by the pandemic, and we're seeing the impacts of that. I will also say, and I think many communities around Canada can attest to this, housing and food insecurity is certainly a challenge across our country. The rising costs of just living is making it really, really hard for people to be able to afford the basics. And so oftentimes we're seeing that present itself within our hospital sites, seeing people, coming in because they're hungry, or they just don't have a warm place to sleep. And so these sorts of challenges are presenting themselves within our hospitals, and our hospitals aren't designed to support those sorts of needs. And so it's adding that additional pressure to hospitals and funding and operations. And so it's kind of this domino effect. And so, we're really grateful for the support through Novartis and the work that we're doing to help support the work that we're doing through social prescription.
Thank you very much for this overview, and again, touching such basic needs. It's so important, and also the mental health, let's say, issue is something that unfortunately it's really a trending topic across different areas, and it's really a concern. So thank you for offering your perspective on this. And now I would like to address another question to Charles for Moms Against Racism Canada, because that organization offers culturally tailored care. And maybe for our audience not necessarily familiar with what does it mean, can you maybe define that? What are the benefits of having culturally tailored care when this is included in health equity strategies?
Of course. So at Moms Against Racism, when we talk about culturally tailored care, we're talking about care that sees a whole person. And I know that term is used often, so just bear with me. Not just the symptoms, but the story of each individual. So for many Indigenous, Black, and other racialized communities, healthcare is not a neutral place. So our experiences of racism, dismissal, stereotyping, and not being believed really shape how we show up, or whether we even feel safe enough to show up at all. So culturally tailored care begins by acknowledging that intersection of racism and healthcare and the different layers people carry with them into a room. So going back to the mainstream care that we often hear, the whole person, which is great. That includes emotional health, family context, lifestyle, and mental well-being. Culturally tailored care takes that foundation and adds what historically has been missing. So the cultural context, spiritual context, community relations, our histories with healthcare systems, our relationships to power, and impacts of chronic and intergenerational health inequity. So in that care, the healthcare reflects those realities, something powerful happens. People feel truly seen, validated, not blamed for the ways they've learned to protect themselves. And when someone feels that level of trust, when they feel seen, they feel that level of trust, and that trust becomes possible. And that trust is what turns a healthcare plan from something imposed on them and onto you into something that we can truly engage in and engage with. So culturally tailored care really shifts from a deficit-based Western medical lens, which often treats neurodivergence or disability as something to fix, to a neurodiversity paradigm. So what that is that many cultures already understand neurodivergence as a natural, valuable form of human variation and not a flaw. So culturally tailored care honors that. It's liberation, it's empowering. And ultimately, the benefit of culturally tailored care is that it leads to better access, better outcomes, and a deeper sense of belonging in systems that were not originally made for us.
That's super interesting, and we know how difficult it is when you need to shift the paradigm and not just do something different. So it's really valuable, the work that you are all doing. Thank you for that.
Thank you.
And now we are moving to breast cancer. I think that unfortunately, almost every person knows someone being touched by this disease. But still, unfortunately, there are a lot of challenges in terms of screening for this disease. Recent data states that only 15% of women receive breast cancer screening in the last year. And if we look at some minorities, ethnic minorities, or women who have low income, the number goes even more down. So I want to ask from like the olive branch of hope, what stands out the most, and how is this organization really stepping in to make a difference in screening and access? So Patricia, I would like to hear from you. It's okay.
Thank you, Rosa. You know, when we think of the percentage of women that are receiving screenings, it's deeply concerning because it is low, with 1 in 8 women being diagnosed every day. And up to about 85% of those that are not getting screened are facing barriers related to a minority status or lower income. And they need to be targeted for support and for screening. And that's exactly what we, the Olive Branch of Hope, are focusing our efforts on. We're working to reach women where they are. So through clinics, community centers, hospitals, and interaction with clinicians, so that they can get accessible, reliable information and screening resources without the added struggle. And so our goal is to ensure that they're informed and that they know that they can get support where it's available and where it's accessible. Black women are likely to be diagnosed later. We are caregivers. We are constantly taking care of everybody else except ourselves. And we're noticing that the age group of women younger is rising as far as the diagnosis. And so we're trying to close those gaps, whether it be accessibility, whether it be knowing where to get the information, and addressing them where they are culturally. There's a lot of cultural dynamics involved in even wanting to find out information and get access to that information. And so we're trying to fill that gap. We're working really hard on it. And I think that we are making progress. And with Novartis's help, we're so grateful. We are going to make a greater dent.
Oh, that's really good. And I think building on what you just said, we can go into another section of our conversation related to empowering the communities, because again, the spirit of the Novartis Health Equity Initiative started by listening, but also empowering local solutions for the communities where they are. So I would like to hear from you your perspective on empowering, and educating about advocacy for the local community, because also talking about breast cancer, a diagnosis can be overwhelming even if you have access to care. So what's the value of advocacy, how we can empower even more?
Well, as someone who has experienced and been diagnosed with breast cancer, not once, but twice, I understand the power and the importance of advocating. When you see somebody who has experienced something, they look like you, they have things in common, they sound like you, and have walked the road that you're on, your words carry a very deep and a very heavy weight of support. And so, as a survivor, as a thriver, as somebody who has sat in the seat and heard the diagnosis given to them, self-advocacy has been essential for me. I understand the emotions that come with entering into a healthcare center, into a healthcare environment, the fear. I understand the hesitation and the uncertainty. I felt all of that, and yet I've still had to speak up, to ask questions, and to share my concerns and ensure not only that they were heard, but that they were understood coming from me and addressed honestly. People in marginalized communities deserve the same sense of empowerment. And when guidance comes from a voice that you recognize, that you can see, and that you relate to, and you can trust, it becomes easier to step forward and advocate for yourself too. And I think it's very important to empower women to advocate for themselves.
That I absolutely agreed, and really touched me your part when you said you just don't want to be heard but understood, and there is a big difference about that. So again, what's the importance of self-advocacy? Because again, like there could be a community advocacy, there could be some people voicing also for others, but what about like the self one? And also big thank you for being so vulnerable and sharing part of your journey with us. That's really appreciated.
Thank you. There's a saying that says, he who feels it knows it. When you feel the pain, you have to use your voice. And many times there's a lot of women that don't use their voice. For one reason or another, they've been shut down, they've been told to be quiet, to be silent, but you have to use your voice to get the needs met that you have. And I learned walking through the system the importance of clarity, the importance of saying it, the importance of being bold about it, because I have a need that needs to be addressed. Somebody else could speak on my behalf, but if it comes from me, and if it comes from me with that passion and that clarity, then it's easier to be able to communicate it. And I found that advocating for myself and helping other women to ask questions and giving them some tools of how to be able to navigate the system, they gain the confidence. And when you have that confidence in navigating the system or navigating the advocating for yourself, it's not going to only encourage you, but you're going to be able to encourage somebody else.
That's amazing, absolutely, and staying on the advocacy and let's say the importance of advocate for access to care. I would like to hear also your perspective, Char, in terms of what are you doing as an organization to really improve equitable access to care every day.
I think with Moms Against Racism, we really talk about stop breathing hate and fear into the next generation, and instead to really foster acceptance and love. Is that what we wanted to get into there, Rosa?
Yeah, absolutely.
Yeah. So with us, it's how we foster that is that every adult in a child's ecosystem, because we work with mostly how to be that maternal role within a child's life, is to then be able to show them, as you know, and any adult in the ecosystem is their parents, educators, healthcare providers, community leaders, to really commit to showing up curiosity, compassion, and truth. And we, as adults in that child's ecosystem, to model that acceptance and dignity in everyday interaction, so that they are able to then model that and advocate for themselves. And that really, really helps with what the children inherit and create conditions where equity can finally take root in their lives. And so when we talk about that equitable access to care, we have to recognize that it's not something we can achieve in a single policy or a single training. It really requires the change at 4 interconnected levels: the internal, the interpersonal, the systemic, and the structural, all built on one another. So we can't really skip steps. So at the internal level, it really starts of who we are and how we show up. And so with that, we need awareness, desire, and knowledge. Essentially, the willingness to reflect on, examine what we've been taught, and then unlearn it. This is where the emotional intelligence becomes that tool for equity and for self-advocacy. The contextual education becomes a tool, and the lifelong work of rewriting the biases and stereotypes we've absorbed become a tool. And like I said, it's lifelong work for the adults and the children. And within that internal foundation, nothing else really sticks. So we end up recreating harm even if we don't mean to. And then from the internal, we then move to the interpersonal, and how we relate to one another really shows up too, right? It's not enough to know about that internally, but how we practice it in real time with real people and advocate for ourselves and advocate for others. This means developing the ability to put that internal work into action and surrounding ourselves with communities of culturally responsive practitioners who can support us in doing the hard things. The anti-racism education and cultural humility frameworks and the trauma-informed practices are all tools to help us understand how histories really shape the fears and hesitations and protective behaviors that Indigenous and racialized patients bring with them, and how we might not be able to advocate for ourselves within the healthcare system. And when we understand the why beneath that behavior, the relationships become safer and more honest. So similar to what Patricia was saying, some people aren't able to advocate for themselves, but they need that confidence. So being able to meet people where they are at, including these layers of racialized communities in that context, really helps build that confidence as well. So then we move into the systemic level, what our organizations punish or reward, track or ignore, and uphold or address. This is where that culturally responsive structures might be built into the actual delivery of care instead of bolted on as some afterthought. So we must bring awareness to systems and how the leadership has buy-in into these systems, and organizations that know their values and how to translate that into practice, and not just values on a website or spoken. And so here, this is where the race-based data becomes a tool for truth-telling and be able to have adequate resourcing for EDI and anti-racism teams become a tool, and accountability processes that actually uphold anti-racism and anti-discrimination and anti-harassment policies, and not just in theory, but in enforcement. That can become a tool here. For neuroequity specifically, when organizations introduce culturally grounded assessments, community-led peer support, staff training rooted in intersectionality and accessible intake processes, they can begin to remove those barriers that people don't put themselves there to be able to advocate for themselves. So when the interpretation of cultural bridging and space for traditional spiritual and land-based healing are incorporated, it really signals to families and individuals that they don't have to leave a part of them at the door when they're trying to be cared for in the healthcare system. And when these structures exist, that belonging becomes possible, not as an extra, but as a standard. And so that's when people can advocate for themselves more in a safe space and have that psychological safety. And so my last point here is like with the structural level of change, when that happens and many organizations commit to these shifts at the same time as a collective, when multiple hospitals, clinics, community partners, educational institutions, and health agencies and practitioners really bring that culturally responsive and trauma-informed practice into their policies, into life, and not just a policy, the care pathway and their leadership models really help create that momentum that individuals really need, that organizations can't achieve alone. It really has to be a collective effort. And that structural change is when equity can stop being a pilot project and becomes the way an entire system operates. And it's where the point, like I said, culturally safe, trauma-informed, identity-affirming care becomes not the exception, but the expectation across the whole sector.
I could not agree more. I think change is possible when we work together collectively as communities, institutions. So it's really possible. And what came to my mind when you were describing all the process between internal, external, and system is really that if you want a famous saying that says, if you want to go fast, go alone. If you want to go far, go together. So let's have this ambition to change the system together. And also what I was hearing, listening to you, was a lot of mutual learning, gentle, let's say, leadership. How do you think these elements can really empower people in care roles?
Yeah, I think because even the people in the care roles are humans and they're individuals, right? So when they are showed how to model that and taught, doing that inner work to model that, they feel seen and validated and they can show up even as the providers, the care practitioners, healthcare practitioners, then they can connect, with that vulnerability within even a healthcare professional sense, right? With that connection, that human connection and relational connection, then we can have that transaction. It's not just transaction based about here's a care you need, right? But you're really meeting people where they're at. And again, the practitioners are humans too. So I think when they see that, they're able to connect more and share that. And that's really empowering because then you don't just see another patient as a number, right? And it can get hard. And I'm it's the system, like we said, system, structural, internal, and interrelational. That's where it all comes together as we're empowered as humans to just show up as ourselves. Kind of back to the first one, like as our whole selves. And I think that's really empowering for us to show up as ourselves. And that's when we can really be able to connect and provide the best care and get the best care.
Absolutely. Thank you. Thank you for this perspective. Now I would like to listen from Rochelle, staying on the advocacy piece. I think we all agree on the importance of advocate, self-advocate, but moving specifically to HHS, let's say, approach. Can you share, Rochelle, with us what that means and how this holistic care model that you are providing is helping both providers and patients advocate for more balanced care in, let's say, care centers and prescribing mode, social prescribing, sorry.
Yeah. So, our approach really starts with walking alongside and engaging with the community. And so that is essentially the foundation of how we work at HHS, how we innovate at HHS, and how we implement new initiatives. And so That piece has been crucial to the development of social prescribing, and also looking at the inputs into social prescribing. So when I say social prescribing, I know that might sound a little bit odd, because from a medical perspective, we all understand, if you are seeing a care provider and they're giving you a written prescription for something to heal whatever that symptom is that you're presenting with. But we've talked about the approach to holistic care, and the essence of social prescribing is understanding that this individual and this patient comes with many, many things. And so looking at all of those things from a social determinants of health perspective is really the approach around social prescribing. So it's really about recognizing that health is shaped by more than medical treatments. And it really is looking at the advancement of health and well-being of patients in a holistic way. So our approach has been to connect with and work alongside community partners to be able to partner our patients with community-based supports that they may present with. And so that could mean things like housing supports, food supports, mental health resources that aren't offered within the hospital, or even things such as social and cultural connection. We know how important that is from a health perspective to have that sense of connection and community. And so the social prescribing work is really centered around how a patient presents holistically. And we're able to obtain that information through an initiative that we've implemented over the last 2 years called Care Data. And so it stands for Collecting Accurate and Robust Equity Data. And so that initiative was really focused on, again, working alongside community to understand what sorts of questions should we be asking during an intake within our hospitals. How should these questions be asked? What should these questions be used to inform? And so we've kind of taken that process to be able to inform to be able to collect and then inform our social prescribing initiative. And so that has now enabled, from a provider perspective, to give them a structured approach to how to respond to patients when they see patients come in with challenges that go beyond a medical diagnosis, and provide some process and resources and systems in place to be able to kind of bridge those gaps and be able to help the patient be well holistically. So from a patient perspective, it means that their care plan, is more holistic, acknowledging that the realities of their daily lives and, helping them access those supports will absolutely improve their health and well-being and ultimately quality of life. And then, it then impacts what I spoke to very early on in this session about impacting, quality of life and life expectancy. And so oftentimes we're seeing folks present within our hospitals that don't necessarily need immediate acute care, but there is absolutely a need there. And so with social prescribing, it has given us a vehicle to be able to support those patients that do present with some of these external challenges.
Thank you. You also sparked my curiosity, and I would love to hear your perspective on AI. Because when you mentioned the importance of data, I think we all know that data can drive improvements and help many areas of health. What do you think is the role that AI will play in health equity? Will be helping or not? $1 million question, I know, but
Yes. And
I'm
if I have
curious
the
to hear
right
from you.
answer
And I love also Char and Patricia to contribute to this.
Yeah, I'm happy to start. I mean, I think that AI is an incredibly powerful tool, if used appropriately. It can be a very, very powerful and effective tool, but it also has its challenges. And I think that we have to be mindful that ultimately we are the humans behind the tools. And so ensuring that the systems and the tools that are set up are inclusive. And when I say inclusive, ensuring that the data that is being leveraged to inform the tools understand kind of the inclusiveness of a given organization, a given community, so on and so forth. But not just understanding those differences, but also understanding the nuances and the intersectionality of equity data and how to utilize it in a way to inform better decision making. And I think that we see that often in the work that we do in the equity space, in terms of how when we take an equity informed approach to solving problems, that we're able to come up with better solutions for all. And so oftentimes I will hear from folks, oh, well, you're just focusing on one unique group or one area. And while that may look like it from an optics perspective, it's actually about better care for all. And so I think from my perspective, I think AI will be transformational in how we access services, access care, but we have to be very mindful about the information that we're feeding it in the back end.
Thank you. Shah?
Thank you. Yes, I think, no, I know. I agree with Rochelle as using AI as a tool and remembering that it's a tool and it's not a replacement because, as Rochelle touched on, the nuances is that AI, depending on the input that we put in it and the tools we use with AI, yes, they're transformational and are very valuable and can help you save a lot of time too, of course, right? But remembering that it can't replace you to be culturally informed and grounded and trauma informed and neuro informed as well to integrate that into the output is, right? So I think using it as a tool and not a replacement for our own lived experiences and our relational interactions and connection that we have with people. And that's where we need to make sure we are mindful of that discernment, right? Just like with social media and anything else we kind of have access to now with all the technology, is remembering you're human first. We're all humans first, and making that discernment and making sure we keep in touch with our human connections is very important. And using AI with with integrity and remembering the human dignity is very important. And so, yeah, fully agree with Rochelle is that it's a tool, transformational, great value in using AI, but making sure we still stay grounded in our human relational interactions.
I love that. I love that. Patricia, do you want to close this question with your opinion?
I think the ladies covered it all. The importance of remembering that we are human beings, we are individuals. Collaborating and sharing our information together is extremely important. Rosa, you talked about, going on a journey, going on it alone. You won't go far, but you will go further if we go together. And so as we share and collab and share information, it's going to empower us. AI is a tool. And I think that is the common word that we have to keep reminding ourselves and reminding each other. It is not a replacement, but we use it to serve what we need. We still need the interaction. We still need to see each person as an individual. Every individual's diagnosis, you might say this person has breast cancer, and this person has breast cancer, but they may have two different cancers, and they're still two different individuals. So if we continue to keep that in the back of our mind, to use A to serve our purposes, but continue the human collaboration, that's valuable.
That's a very strong message of ownership. I would say owning the journey and using the tool for the best. So I love this perspective and this optimism, and this can lead us to the next section, which is about the future. I'll say we have touched about the challenges, we have touched about the importance of advocacy, and now let's look at the future. We have a lot of leaders in the system connected today, listening to you. And I would love you to share with our audience what are your goals for 2026, and also what will be, let's say, the goal that you aim to achieve with the health equity support that you got with this initiative. So maybe we can start with Char, and then Patricia and Rochelle.
Great. I'm excited for this part because we'd love to tell you. For us at Moms Against Racism, for 2026, we are using deepening and scaling as kind of like our key themes. What we've already seen working through the Neuro Equity Project pilot. We launched the pilot in January of 2025 this year, and the demand has been overwhelming in the best and the hardest ways. So with the Health Equity Initiative support, we're actually focused on three big areas. First, we're going to be expanding access while protecting the quality and cultural safety. We want to reach thousands of more neurodivergent youth, adults, and caregivers across BC and Canada, especially those who are racialized, Indigenous, and rural areas, or otherwise pushed to the margins of care. Practically, that means hiring and supporting more clinicians and peer facilitators with the lived experiences, increasing the number of ADHD and autism assessments that we can offer, and growing our counseling and peer support groups so people aren't sitting on wait lists for years. We'll be using innovative tech solutions to scale this in a meaningful and thoughtful way, which would help us reach communities that don't have local services, and using secure data to track the outcomes and making sure our care remains trauma-informed, culturally grounded, and neuro-affirming as we grow. Secondly, we will be investing deeply in community-based research with UBC, our partners at UBC, which is the University of British Columbia. One of the most powerful parts of this next phase is our formal collaboration with UBC researchers. Together, we're embedding research directly into the service delivery we can learn, which would have the community-led, culturally grounded strategies become more effective and help build trust and reduce the stigma-related barriers to neurodevelopmental assessment and support among the racialized and Indigenous communities in what context do they work, for whom they serve, and why. In 2026, that will look like mapping and the trust dynamics in the access to ADHD and autism care. That would be evaluating our assessments, counseling and peer supports as interventions, and co-designing tools that can be shared with the wider community. Things like training resources, practice guidelines, and policy recommendations that are rooted in anti-racism, trauma-informed care, and cultural safety. That's what we really hope to really build and share. And this research will be done with and for community. So we would invite and include families, elders, and people with lived experience. They will also be at the table, helping to interpret the data and define what success looks like. Third, we're building the partnerships that make long-term system changes possible. So we know the Neuro Equity Project can't do this alone. So a key goal next year is strengthening the strategic partnerships for both project resourcing and implementation. That includes additional funding partners and Indigenous-led organizations that we can work with, rural health providers, schools, community health centers, and other mental health teams who want to bring culturally safe, neuro-affirming care into their own settings and environment. with the Novartis support, we're able to co-create the training, referral pathways, and share these care models that serve individuals and families and also help shift how institutions think about neurodivergence, race, and mental health. As mentioned, we're also working with partners like UBC to build evidence base that can unlock future government funding, philanthropic investment, and integration into public systems. So this work doesn't end with just when the one single grant ends. Under all of this is very simple. The radical hope that racialized and neurodivergent people will no longer have to choose between being safe and being honest in the healthcare setting. And so by the end of 2026, with the Health Equity Initiative's support, some of our measures of success will be reduced wait times for racialized and Indigenous families in participating communities, supporting thousands of people through assessments, counseling, groups, and education. And lastly, clear community-led evidence we can share with policymakers, clinicians, and other organizations who are ready to transform their own practice. So for us, success isn't just the numbers, of course, though. It's hearing young people say, I finally understand my brain and that I'm not broken and I'm not in need of fixing. And a caregiver saying, we don't feel so alone anymore and we know what to do next. It's communities healing from colonialism and from the racial and neurodivergent harms embedded in healthcare and reclaiming joy and agency in their own well-being. And it's seeing the social determinants of health, safety, stability, connection, and belonging start to really shift in ways that make health equity real. And that's what we at Moms Against Racism is looking forward to in 2026. And we're so deeply grateful that Novartis is walking alongside us in all that work. So thank you so much, Rosa, and your team.
No, thank you. It's a privilege and an honor. We are very proud to support this initiative along with Hamilton Health Science and Olive Branch of Hope for this year. Very proud and looking forward to see the impact next year. So now, Rochelle, do you want to share also how 2026 looks like for you with this initiative?
Absolutely. So 2026 is an exciting year for us at Hamilton Health Sciences. So we will be launching our new corporate strategy in 2026, and health equity will be a key foundational commitment of that strategy, which is very exciting. And so what that means in practice is that we'll be really focused on building stronger relationships with our patients, our community partners, and the broader community to ensure that we have the right social supports in place for patients to be able to truly thrive. And so our goal is to ensure that the generous funding that we received from Novartis will be put to good use to help to support that. And so some of the key areas of focus for us will be to continue to advance on developing our partnerships with community organizations and to ensure that we have clear and simple access pathways for folks to be able to access the care and the supports that they need. Also, building awareness of health and wellness within the community is also a key aspect of this work. And as well as there's also a technical aspect to social prescribing and ensuring that our systems are seamless to be able to implement a proper workflow into our electronic medical records system. And so this funding will help to support that technical enhancement that is required to ensure that we have proper documentation as well as a seamless system and a seamless procedure for how patients will access social prescriptions. And then, there are many things that are happening from a HHS perspective where equity is concerned. We will be launching our new Black Health Plan in spring, and so these funds will also help to support some of the specific programming around Black social prescribing for Black communities. And so, again, really appreciate the leadership from Novartis, the commitment from Novartis, and the support that we've been given through this funding. And I just, for those that are listening and who will be listening after this recording, I just, if you don't take away anything from today, just really want to reiterate that regardless of what we're hearing and seeing kind of happening around us, equity is a key function to every organization. And it really is, if we're striving towards better processes, operational excellence, and enhancing the workplace culture of any organization, equity has to be at the core of that. And so I encourage those that are leading organizations and or those that have a position of influence to really ensure that equity is centered in your leadership and in your future plans. So thank you so much.
Thank you. Thank you, Rochelle. And we have the last 4 minutes. So Patricia, over to you before we close.
Rosa, thank you. And we're in such great company with these winners. And 2026 is going to be an exciting year. We are so grateful to Novartis for this gift that is going to help us to continue to make an impact in the community. We have an Empower Her program that addresses all the areas of women, not only the physical aspect of breast cancer, but mental and emotional. We're going to be able to continue and expand on those programs in serving the community. We want to increase the awareness and early detection, reaching more Black women and other underserved communities with culturally relevant information about breast cancer, especially triple negative breast cancer, which, by the way, is what I had, which is a very difficult type of cancer to address and which occurs very much highly in women from an African diaspora. We want to encourage close the screening gaps. We want to focus on that, partnering with local hospitals and clinics to increase mammograms and follow-up care for women who might otherwise go unscreened. Very significant. Also, we're going to continue empowering self-advocacy, equipping patients with knowledge and confidence so that they can navigate the healthcare system and advocate for timely, quality care. And finally, amongst a few other things, we want to engage the next generation. A lot of us have been working very hard in the background for several years. The Olive Branch of Hope will celebrate 25 years next year. So we're engaging the next generation, implementing workshops and programs for younger women in schools and universities, and helping them understand the risk and prevention as well. So we've got a lot of work to do, and we're so extremely thankful to Novartis for being a part of advancing the work at the Olive Branch of Hope. Thank you so very much.
Thank you. Thank you, Patricia. Thank you all. I think we are coming to an end. I cannot believe that an hour already. It's already gone, but thank you to all the panelists, Char, Patricia, Rochelle. Really, it was amazing hearing from you. And we are very much looking forward to see the impact that you will have with this initiative. And thank also to all the people connected to listen to this webinar. If you want to hear more about the Novartis Health Equity Initiative and the amazing work of our winners, please visit our website and check it out. Also our social media channels, Novartis Canada on LinkedIn. And with that, I thank everyone for being with us today, and have a good rest of your day. Thank you.
Thank you and good day. I hope everybody has a wonderful day.